All right, good afternoon. My name is Eric Richards, and I'll be giving a demonstrative speech this afternoon on how to use the polyloop ligation device. But first, let us talk about some situations in which we find ourselves in where we're in a tense procedure, where a patient may be a free bleeder, or you may have some cancer, or any kind of situation where it's very critical and the tensions are very high, and the doctor looks to you and you're assisting them and they ask for a piece of equipment that you're not familiar with. That can cause quite an anxiety to flow over the body, and you can become very nervous and agitated, and that can spread amongst all of your other coworkers and everyone in the room. So our purpose today is to demonstrate how to use the polyloop ligation device. And then what we're going to do is talk a little bit about, I've been a surgical tech in the GE lab, gastroenterology department for about 3 years, and a nurse in the gastroenterology department for over a year and a half. And during those combined years, we've used the polyloop ligation device 3 times total. So, and what you have to do is, you have to realize that you must be proficient with equipment that you don't use often in order to make sure that when you do use it, you're ready to use it, and that way it can be a calm, safe environment for everyone, and that you're able to provide excellent care. All right. Now, also patience and proficiency help to provide calm and confidence during a critical situation, and that's one of our main goals for today. All right, so this is your polyloop ligation device. On the back package it says polyloop, has dimensions written right here, and it also has your expiration dates. Now, for departments that use many different dimensions and types of ligation devices, you may have different sizes. This is a 30 millimeter standard for our department, and we use only one. Okay, now ligation, for those who don't understand what that means, the word ligation means to constrict or bind something with a ligature, and it comes from the Latin word ligatus. What you will do when you're asked to use the polyloop ligation device, you're going to open up your device once you've made sure that your device is not expired, and it comes packaged as thusly. So you have your device, you have the end with the loop on it, and it's visualized right here so you can see that it's intact. You also have the other end of the loop, which is the plunger, and then you have the plastic sheath, which is controlled by this yellow button.
I think everybody is, so yeah.
So what you'll do is, once you've been asked to use the ligation device by the physician, you'll open it up, you'll get to this point, and you'll pull back on the plastic sheath in order to make sure that your loop disappears inside. It's to protect the loop so that as it's passed through the scope and into the patient, that it doesn't become entangled, snared on anything, or broken. Once it's here, you can hand it to the physician for him to introduce it, or you can introduce it yourself. He puts it into the patient as you continue to go through the scope. Once it's visualized, you want to open it back up. Now, the way you open it back up is simply the reverse of how you closed it. You'll take this yellow portion and you'll slide it until you get to the handle with the plunger on it. You want to go all the way up to the top so that it exposes the entire loop. Reason for that being, if you expose just this portion and then you begin to squeeze later to deploy the device, you'll pull everything against the sheath. So you want the eye to be open. You want Polly to be able to see. So she has opened her eye all the way up. Now, once you get to this part, all you can do is sit there and hold it. Now, this is the part where the surgeon places the device. Yes, please. And today we're going to use a sponge to simulate a piece of tissue for this device. And what you'll do is you'll have the device, the loop placed around the tissue that's your object, whether it be a bleeding vessel or any kind of cancerous tissue or polyp. Now, at this point, you want to move it to the back of the loop so that when you begin to use the plunger to close the loop, you will see how much you're closing it. If you close it from here, sometimes you can't visualize how much of the loop is being closed, and you can actually cut through the tissue that you're trying to ligate. So as it comes back and you begin to get closer and closer to the tissue, you keep communication with your physician saying, is that enough? What do you think about that? They'll be fine. Eventually you'll get to the point where the tissue will become strangulated and will become pale, meaning that the blood circulation has been cut off to the tissue. And that's the object that you
What was that word? Come pale?
Strangulate.
Okay.
Become pale.
Oh, become.
Pale.
Okay.
Strangulate. Sorry, if I'm going too fast, just let me know and I'll slow down. Now, once you've got it to the point where you're comfortable, the physician's comfortable, to deploy the device, you simply open the plunger all the way up as far as you can, and it unhooks, and there you have the strangulated tissue there. And then hopefully, without any kind of bleeding or complications, you can allow the tissue to either slough off, or above that loop, the poly loop, you can remove the tissue without any fear of bleeding. And so basically, that's what we want to do. And you want to become familiar with this device. You want to make sure that you know how to use it, because you may only use it once or twice in a 5-year span, but the times you do use it, it's usually a critical situation, and it's one of those where you need to know what you're doing in order to promote confidence amongst your coworkers, and especially the physicians. Always clarify with your physician. If they're comfortable with it, then you should be comfortable with it. And if you think that you're not in the right spot, do not hesitate to tell your physician you don't feel comfortable with that position, and then maybe they can readjust, because you might see something he or she doesn't. Just to sum up the theme of this speech is that confidence and calm are the goals, and impatience and proficiency are the path to these goals. And I thank you very much.
Thank you.
Excellent. Excellent job. Good job. That was very good. They need to come and do it.
Yeah, it's better than the rest.
Much
Yeah,
better.
much better than
Do you want us all to sign the paper so you have the right amount of names down?
She doesn't go for that.
He's doing a visual.
Yeah.
It's a visual.